Going to the hotline right now, we have Dr. Joe Congeni from Akron Children's Sports Medicine right now. And Dr. Joe, good morning. And I got to ask you first off, I'm sure you saw this report about CTE with football players.
I did, Tony. Thanks for having me on this morning. Good to get a chance to talk to you. It's very misleading. I don't like the way a lot of the headlines, I heard it yesterday driving somewhere, and they said that almost everybody they checked was positive for CTE, and they neglected to say, and if you just looked at the headlines, they said the same kind of thing this morning, brain disease detected in most football players. But what they meant to say is most football players that were in this brain injury study, 200 plus people that they looked at, that had specific symptoms later in life and things like profound depression and dementia and other things where their families donated their brain to be studied. So this is not indicative of every football player that's ever played, only the 200 that they looked at, and most of those, the great majority of those, did have CTE. So it's concerning, and we're trying to learn as much as we can by this story, by this study, too. It's a little misleading to say that that's the case in every football player because it's a very small sample size of one study that's being done at Boston University.
Yeah, the story came out yesterday. Dr. Ann McKee examined the brains of 202 former football players. 111 of them played in the NFL, and of those 111 brains studied, all but one were found to have some form of CTE, and the majority of them being offensive and defensive linemen, followed by running backs. It's kind of self-explanatory. Those are the positions that take the biggest beating. But like you said, I guess it is in a way a misleading report, but it also brings about the other side of that where it's not necessarily NFL players with the CTE. Where did this begin? I know when I was a kid, I played cadet football at St. Monica's School up in Garfield Heights. I was in 6th grade, and I knew that I was able to sack the quarterback, and I was able to make tackles and get through the line by putting my head down. And then I realized I started getting a couple of headaches every now and then. When I knew it was starting to get to be a problem, like where it was like, oh, I'm not supposed to get headaches here. What's going on? I stopped playing. It's the age-old question. Where does this begin?
Yeah, so, we don't know the answers to that. And Ann McKee's been doing this for a long time. We're very well aware of her work. This is the same study, Tony, that has had Dave Duerson, Junior Seau. Every couple of months you hear of somebody who's having bad symptoms or significant life circumstances of symptoms, and their family donates their brain later. Again, this study can only be done in people that have passed away, people that have died, and they are able to look at a postmortem of the brain to be able to learn these things, looking at it under a microscope. So she's gathering information. In the meantime, we're trying to gather information. There's a few studies going on, and you may have seen it in this report as well, Tony, that they're trying to come up with ways that we could diagnose it before you do it at an autopsy, at a postmortem, and trying to do it by way of some of the good imaging studies we have and pick up. But it's very hard to pick up on this tau protein that we're looking at that leaves the brain, not functioning well. And so this study's gone on a long time. There's still a lot to learn. We have absolutely no good idea, and I'll tell you this, of what stage, how many hits, whatever. There's just no good way to know when we start getting into the fact of being at risk for more permanent type changes in the brain. We just don't have a good idea clinically about those kinds of things. But let me also let you know that there's a lot of research going on. We talk about it on this show, as you know, all the time, Tony, with you and Ray, about lots of good studies going on, and we're getting closer to some of the answers. But one of the answers we do not have right now is at what point does the brain switch over and you start getting into chronic, non-reversible changes. We don't know that.
Dr. Joe Congeni, Sports Medicine, Akron Children's Hospital. It's really is another age-old situation here when you talk about the techniques, and they're trying different tackling techniques and where you can hit and different helmets, and as you've talked about. But it ultimately comes down to this, and I've spoken to former football players who I don't know if they go on record as saying this, that they would put their name to it, but a lot of them say if you want, basically the only way you're going to prevent head injuries in football is if you take away the helmets. As strange as that is to say, that's a way where it would prevent injuries. Could you conceivably see that the NFL could go the way of rugby and maybe even go away from these large, like Great Gazoo helmets that they have in order to try to stop this and try to say, look, if guys don't have helmets or have very little protection, they're not going to, like almost going backwards in time to the 1920s. Could this conceivably happen at some point?
Anything could conceivably happen. There's a lot being looked at and studied, and I am asked that question very frequently when I'm out speaking, publicly about this condition. I am asked this question. I don't think it's imminent in the next 3 to 5 years. I think it's something that might be further down the road. But we're looking at pilot programs. They're looking at pilot programs, like you said, with tackling technique and other things. Maybe at some point there would be a pilot program of helmetless football. The problem is that the helmet is being used as a weapon. And so people are leading with the helmet, as you said. And so I don't see it as being one of the imminent things. I don't hear of anybody talking about it happening right away in the next couple of years. But I think anything's on the table right now when you're looking at trying to solve this problem and ensure safety as best we possibly can. Now, nothing is totally insured, and so we know that in many other sports besides football, so what are we going to say about that in sports like soccer and basketball, which have some of the highest rate of increase in concussions are in sports that are played without helmets or headgear. So, a very, very difficult issue, and I don't think that we're right on the cusp of seeing studies without using helmets in the sport of